Hi everyone, I'm Katie Zaffel, Marketing and Communications Director at Rogers Behavioral Health. We are so glad you could join us today for our Facebook Live Q&A. Today we are so honored to have Mackenzie here with us to share her story of mental health recovery and how the Rogers Behavioral Health Foundation supported her on her journey. Also with us is Matthias Schuth, Executive Vice President of the Foundation, who will provide insight on the amazing work that the Foundation does for patients and treatment programs. If you have any questions, we'd love to hear them, so please feel free to post them in the comment section below, and we will do our very best to answer them at the end of our discussion. Mackenzie and Matthias, thank you for being here.
Thank you for having us.
Thank you for having me.
All right, let's get started with some questions. Matthias, let's start by discussing a little bit about what the foundation is. Could you share the mission of the foundation and how it helps support patients and Rogers programs?
Yeah, so the Rogers Foundation is part of the bigger Rogers Behavioral Health System. We are a 501c3, meaning what we do is we raise funds, we collect donations, and then we support patients and programs in the area of advocacy, treatment, research. So we have one area that is very individualized and really helps patients and families very directly. You can think of it as a scholarship at a university. So unfortunately, with insurances in mental health, very often insurances cut treatment short and tell you after 3-4 weeks you are done, you are supposed to leave treatment, but the treatment team thinks, no, the patient needs more treatment, we are not done yet. And in these cases, the treatment team can come to the foundation, can apply for a grant. And if we have the funds, and more often than not, we do have the funds, we pay for the patient and the family for free treatment. So that is really direct help to the one patient, but it also helps the bigger system of the family. And then we have something what we call Angel Fund. These are little things that help along the way. With mental health, you do not see the bake sale in the neighborhood, or you do not see the high school class coming around and rallying somebody because it's still shrouded in stigma. So we help these families with a gas card if they want to visit their loved ones while they're in treatment. We pay for a hotel stay from families outside to visit their loved ones here at Rogers. So this is a very individualized help. And then we have the bigger area where we help programming. One area is research. We try to understand better the role of genetics, for example, in OCD and anxiety. We very soon will start a study, or we predict treatment outcomes with artificial intelligence and data research. We installed we helped with a suicide predictability tool. Also, we help with capital projects. Donors helped us to bring treatment to Sheboygan and Walnut Creek by helping us to open a clinic there. So these are the more bigger areas, and stigma reduction and advocacy is a very important part of what we support as well.
Yeah, could you tell us a little bit more about the stigma prevention and advocacy? Yeah,
so as we all know, and probably some of you, the listeners, might have experienced it. It is still surrounded by stigma. It's still in the dirty corner. You don't talk about it as often as you talk about diabetes or a broken foot or a liver problem. And stigma is one of the main reasons why patients do not go to treatment. So we are within the community. We help with programs, evidence-based programs that we run with parents, with students at high school, at grade school, to evaluate themselves and help them to think about whether they would like to talk about their stigma, talk about their mental health issue. And we are funding programs that will reduce stigma and create awareness.
That's fantastic. There's just so much work being done at the foundation in so many different areas. What would you say are the different areas where donations can be dedicated to?
Yeah, so the donor can actually dedicate to various areas that we support, and we are bound by law to really use the donation that is, let's say, dedicated to research. We are bound to put it into our research project, and we cannot dedicate it somewhere else. So the donors do have the chance of choosing between research, patient care grants. These are the individual help to help a patient family who's in financial need to get free treatment, to the angel fund for building projects. They can dedicate it. If they do it online, there's a line, or if they write a check, they are supposed to write it down, and then we are bound to use it that way. They can also say for the greatest need. That's also possible, and then we can use the donation wherever the system sees the biggest need, where we need to plug a hole.
Thank you very much. Mackenzie, now that we know a little bit more about what the foundation is and how it helps patients, could you share with us a little bit about your experience at Rogers and how the foundation supported your journey?
Sure. So I came to Rogers in 2014 to the Focus program. I was 21, and I was struggling with bipolar and OCD, and I was very ill when I came to Rogers. Unfortunately, my insurance company disagreed and decided after about 4 weeks to stop paying for my treatment in the Focus program. And I didn't know what to do. And my therapist was like, well, we have this foundation and they have grants, so let's apply for that. So we did that, and they gave me 2 weeks, which was so generous, and I was so grateful for it. And so I ended up getting to spend 6 weeks at the Focus program, and I made a ton of improvement. Even today, I'm still doing so well because of the time I spent at Rogers. So, the foundation helped, Rogers helped. It was a good thing.
I think it's a wonderful example, Mackenzie. You're sort of, really a poster child, but we have a lot of success with similar patients, that the amount of treatment is really important to get you to the point where you can leave. If treatment is cut short, you do not get to the level of mental health that you're supposed to have. And you're in a perfect example of that. Treatment can work over a very long time. You were here so many years ago, and you're still dealing with it, but you know how to deal with it, and you are healthy, you can study, you're doing your master's right now. So this is a very good example that mental health is treatable, that mental health is not a fate, it's not a fault by the one who is suffering from it, it's not a fault from the parents, it is an illness of the brain, and it can be dealt with if the time is given and with the right specialized program.
Yeah, those are such important points. Go ahead, Mackenzie.
Oh, no, I really do think that I would not have really solidified the things I was learning at Rogers had I not spent that extra 2 weeks there. And that really solidifying those things is how you get like this long-term improvement. And so without that grant, I don't know that I would have stayed well. So it's really important.
Yeah.
Yeah, it's so interesting. We talk about, treating any other medical condition, with a dose of medication and a certain dose. And I know I've often heard, talking about the similar concept within a behavioral health treatment program. The length of stay may be a dose, or the amount of days you're going to treatment may be considered a dose. And just how important it is that you're having your doctors recommend this treatment for you to really get better. And it's just so wonderful that, Mackenzie, that you were able to get that proper dose at the time that you needed it, and that the foundation was able to help you achieve that.
Yeah.
That wouldn't happen with physical health. an insurance company wouldn't stop paying after 4 weeks of cancer treatment. If the recommendation was for 3 months, they wouldn't just say, oh no, 4 weeks is enough. But unfortunately, that happens with mental health. But thankful the foundation, is able to really help a lot of patients within Rogers to stay the extra time to really solidify what you just said, Mackenzie. Last year, we paid about $1.4 million in free treatment, benefiting a lot of patients and their families.
That's just incredible. And it's just something I think that is such an important component of telling the Rogers story and who we are as a nonprofit. And being mission driven. And so thank you for sharing that. And Mackenzie, we talked a little bit about, those extra 2 weeks being critical to, your recovery. So it's been about, 5 or 6 years since you've been out of treatment. Can you share how you've been able to maintain your recovery for this long?
Yeah, so I guess it's kind of individualized, but I have kept up with a therapist. I've kept up with a psychiatrist. I take my medication. My therapist at Rogers said, Mackenzie, if you stop taking your medication, you will relapse. And so I take it even when I don't want to. And the other thing that's really important for a lot of people with bipolar that really it was one of the things that got solidified at Rogers is keeping a schedule and sleeping every night and eating 3 times a day. And that's something that had slipped away from me when I was sick, and I got back on track at Rogers, and I just haven't stopped since then. So it's not easy, but you just have to take it day by day.
And that's what's different to physical health. You have to change your behavior. That's why sometimes treatment takes 6, 8 weeks, 2 months, 3 months, 4 months, because behavior needs to change. And that is difficult. And that, requires time and requires a lot of work on the patient side. And Mackenzie is a poster child for that.
Yeah, it was a lot of work. I don't think I want to relive Rogers just because of it was hard work, but so worth it. Mm-hmm. So worth it. I'm so glad I didn't. I'm so glad that my parents didn't let me come home when I was begging them. Mm-hmm. So parents.
Well, and that brings up a great point too. I often hear at Rogers the importance of family involvement with treatment. Did you have a similar experience?
Oh yeah, my parents and my therapist, even though I was 21 at the time, having my parents involved was so important. Especially because when I came home, they had an idea of what would help me and what wouldn't help me. And also them having that, my parents having that constant kind of dialogue with my therapist was really good, because they were able to give her a perspective on what had been happening that maybe I couldn't. And so, it was really important to have my parents involved. So I really encourage young adults to let their parents be involved if they can, because it was really helpful.
That's great. So, we've talked about how much hard work you put into your treatment experience. I imagine as part of that hard work that education was probably a big component as well. And one thing I think you mentioned at the beginning is that you were diagnosed with both bipolar and OCD. Were you able to get some new clarity or understanding of the connection between the two diagnoses and how they interact together?
Yeah, I mean, I definitely spent a lot of time with my therapist discussing that, because it's such a part of how you decide how to treat someone, especially with OCD, because it requires such a specific treatment. So I remember specifically talking with my therapist at Rogers about what kind of route I wanted to go as far as treatment based on, you know, bipolar and OCD and how they're usually treated and how we could treat them and, you know, here are the options.
Mm-hmm. Can you recall what some of the treatments that that were used in your experience, you know, CBT, BA, what?
Yeah, so
kinds?
we had CBT, behavioral activation, DBT, and then for me, ERP, exposure response prevention, because I have OCD. So, I honestly, medication never helped my OCD, but ERP did. So it's something I really recommend to people with OCD. DBT was so helpful because it kind of changes the way you look at your emotions and how you deal with them. And CBT kind of the same thing. And the behavioral activation was really stuff like getting me to take a shower every day and, you know, reading again, because I love to read and that kind of thing. So.
Absolutely.
You are talking about this now. I think, you know, it's a great example again that treatment works, and it's overall doing this Facebook feed right now really tells the story that we need to talk about mental health. The more we talk about it, the less stigma is surrounded, and the more patients are really feeling compelled and taking the step of picking up the telephone and calling in for a screening and for admission. So the more options we have in advocacy and awareness, the better it is, because it gets the word out, and hopefully, you know, people will do the step that have not gotten the courage to do so.
Yeah, that's a great point, Matthias. Thank you. Thinking about anybody that might be watching our discussion today, Mackenzie, is there anything that you think that, you know, would have been helpful if you were, you know, somebody in maybe someone else's shoes watching today, that might be considering treatment, or maybe, you know, too nervous, you know, to reach out? Is there any sort of advice you might give somebody?
I remember I made my parents do the first call to Rogers. And then I remember when I was gonna do the screening, I was like on the verge of throwing up. But don't be afraid, because the people are so nice. Everyone at Rogers is nice too. And so I'm sorry, I lost my train of thought.
That's okay. Don't you worry. Is there anything maybe about the foundation that you would want patients to know about, or families to know about?
So the fact that it's there, it was really nerve-wracking to go to Rogers and know that every day my insurance could drop me. And I didn't know that there was any safety net for me if that happened. And so I was just like nervously waiting every day. I was like, is this going to be the day? And so while I wouldn't want people to necessarily depend on that, it was good that it was there to be the safety net when my insurance decided not to be.
It's also a great cushion and a great comfort for the treatment teams to know that we can reach out to the foundation. Yeah, because otherwise the frustration level on their side would be much higher to constantly know, oh my gosh, we have to discharge so many patients that are not ready to be discharged. And for them knowing, you know, if worst comes to worst, we can reach out to the foundation, and, you know, very likely they will be able to help, gives them comfort and gives them, you know, a different kind of approaching the therapy with Mackenzie or others, knowing we have a safety net. Yeah.
And my one of the things my mom mentioned to me when we were discussing this the other day was that she felt a lot better because one of the things is insurance companies say, oh, you need to be out by midnight or you need to be out within 24 hours. And my parents on the other side of the country were like, what if our ill daughter like gets kicked out of Rogers by our insurance company and there's no, like, how do we get her home? You know, what happens? You know, it's scary. It's scary for them.
Absolutely.
So it's good that the foundation.
Thank you, Mackenzie. Yes, yes, and it's a great privilege to be able to help so many patients who are so motivated and really want to get better and took that step, seeking treatment. And it's a privilege for us in the foundation to be able to help them. And most of our funds that we actually contribute to families in need come from other former patient families who are in the position to donate and would like to show their gratitude by donating back to the foundation to be able to help patients or bigger programs. So 80% of our revenue actually is really coming from former patient families giving back to Rogers because we saved them, we saved their daughters, their son's life, or their spouse life.
Yeah, and that's such a great testament to not only the work being done at the foundation, but to our families and our patients, just how special everyone is. Matthias, what can people do if they would like to become a mental health or donate to the foundation?
Yeah, thank you. So I just mentioned that, we are a 501c3, we seek donations, we need donations to be able to do all that, what we talked before about. So donating small amounts, big amounts, everything helps, and everything is really going individually or benefiting the wider community through research to new treatment centers. That is one way. And the other way, and Mackenzie again is a good example for that, doing advocacy and awareness. What Mackenzie does now is putting herself out, talking about it, and with her name, with her story, to inspire others to get treatment. So 10 years ago, when I started here at Rogers, it was very hard to find an advocate who would have been willing to be on a video call, who would have, volunteered to speak at an event that we have. But by now, 10 years later, I think we get 1 or 2 calls a week from a former patient, mainly teenagers or young adults who would really like to give back to the foundation, to Rogers, to their community by speaking about it. And they're asking us, can we do a video? Can we come and speak at an event? We have the high school students who ask us, I'm going to be part of our parent basketball game and I would like to raise funds as a third party. Can you help me with material? I would like to speak to all the spectators in the gym tonight and would like to raise funds for Rogers. So that really has changed over the last years and we really hope for more. And people can choose. It's donation, it's advocacy, it's awareness. They can go to our website and send us an email if they would like to become a spokesperson, would like to do something that Mackenzie is doing right now, or they can donate through our website.
That's fantastic. And we can share the link to that website in the comment section below as well. Mm-hmm. Yeah, that just, it just gives us all so much hope to hear that the conversations are happening and that things are changing and so many people are rallying around to mental health and addiction awareness and supporting each other.
Do you see that, sorry, Katie, do you see that too, Mackenzie, that within your peers, within your group of friends, that you are more open about it, others are talking about it?
Yeah, I would say when I got home from Rogers and I started talking about it, I didn't know, number one, how many people struggle. Because once you start talking about it, people start telling you their story.
Yes.
And then number two, everyone was so supportive. And I know that doesn't happen to everyone. Everyone's family's different. Everyone's friends are different. But I got so much support and I'm not open about it everywhere, like at work and things, I don't discuss it, but the places where I do discuss my mental health, I've had nothing but support. So I think things are changing for the better when it comes to mental health.
Yeah, and the prevalence actually, if you open up or if you talk about it, the likelihood that somebody says, oh my God, my uncle, my cousin, my brother has something similar, and they're all happy if somebody takes the first step of taking one breakdown and open a conversation on mental health. We had so many patient families who became sort of resources in their community once they opened up about their child's issues. A lot of other families reached out to them. Hey, where did you get treatment? What did you do? We are struggling with similar things. So every conversation helps, and you're going to find somebody who has a similar experience within their peers, within their family, within their friend groups.
And the other thing is, I have told some people about my bipolar and OCD who were shocked. They're like, I didn't know someone could function so normally who has that. And it's like, yeah, they can with the right treatment. You really can. Yeah. So it's really important.
You're very brave. Thank you for just being so open about it and being a wonderful example.
Yes, thank you so much. So with that, I do see a few questions that have come in for both of you. I think we'll start with a couple of questions for Mackenzie, if that's all right. So first I see Mackenzie, it's so refreshing to hear your perspective. I've been out of treatment for a few years, but I do have my tough days. Any tips you have for sticking with practicing the skills and using the tools you learned in treatment when you have that kind of day?
Well, I would say keep one or two things in your head that you always use. Like there's one for me, opposite to emotion, that is always just something I go to automatically. And it's, so I just keep that in the back of my brain all the time, to use when I'm having a bad day. The other thing is sharing your Rogers binder with your therapist. My therapist is very familiar with Rogers, but we still pull out my binder every once in a while and review some of the things I learned at Rogers. And so pull that binder out. I'm sure you have one, and go over it with your therapist, or even just by yourself if you don't have a therapist, and just kind of remember the things that you learned and make a commitment to practice them in your daily life. Hope that helped.
Thank you. Another for Mackenzie. Can I ask how old you were when you were diagnosed with bipolar?
I was 19. When I was 19, I was diagnosed with depression, and I got put on a antidepressant that made me have a severe manic episode. So I was 20 when I was actually diagnosed with bipolar. And then I went to Rogers at 21. I spent my 22nd birthday at Rogers. So it all happened pretty fast compared to how most people live with mental illness. Most people live with it for a lot longer than I had to before it's properly diagnosed. And so I'm really lucky in that respect.
And just to follow up, did you get your diagnosis at Rogers?
No, I was diagnosed before I came to Rogers.
Before, okay, that was another question. And then another question for you, how was the admission process at Rogers?
Admissions, so how it worked is I got permission from my insurance company to start at Rogers for 1 week prior to my coming to Rogers. So that was good because you don't have to get there and wait for your insurance company to give you permission to enter, I guess. So, and then when you get there, you sign a lot of paperwork, and then they take you to your unit. But the admissions process really starts with the screening when you call and get information, and then they set up a screening with you. And then they say, oh, the wait list is X this long, or maybe there's no wait list at all and we have a bed for you. So it kind of differs probably on the program and the time, and Focus was new at the time, so luckily it was easy for me to get a bed. So it can be a little complicated to get that insurance approval. My parents spent a lot of time doing that. But once you have it, things go really smoothly from there.
Maybe I can add something to that, Katie, if I may. So the screening and the is for free. So everybody who is still on the fence and doesn't know, should I do it, please call. You're going to get an evaluation, what you are dealing with and what level of care we would suggest. And there are no strings attached at this point. And they're going to talk about the insurance and really help you. But it doesn't cost you anything to get that far and to do this very call. So if you're on the fence, please do it. And I do believe our admission people are extremely conscious, very well trained to walk you through the process of screening and diagnosing. So do that first step and you might feel more comfortable than really doing the second step.
Yeah, I agree. And Rogers has so many people who know so much about dealing with insurance companies. It's really great because they can help you.
Thank you.
That is true.
We have a follow-up question for you, Mackenzie. Can you explain what opposite to emotion means? Sounds interesting.
Sure. I think it's a DBT thing, but I'm not 100% sure. You can ask my therapist about that. But it's where, like, let's say you're having a bad day, you're having a sad day. Don't go listen to sad music. Listen to some happy music. Listen to something that gives you energy. Don't do the thing that you want to do, because that's not going to help you. But listen to something with energy, something you love, something that'll make you happy, or watching a happy movie or something, doing something that's opposite to the way you're feeling, and that'll bring you up rather than sinking you down.
That is really interesting. That's I think super helpful for a lot of people. I know I tend to do the same thing. I'm feeling sad, I go listen to some Tom Waits or some sad music,
Oh, I tell my friends about it all the time. I don't tell them that it's a therapy technique, but I'm like, you need to watch a comedy.
Yeah.
Very good, Mackenzie. I love it.
Yeah, that's wonderful. Thank you. Okay, it looks like we have a question from Matthias. Does the foundation only support patients who are treated at the main Wisconsin locations, or does it offer support at other clinics?
No, we offer support throughout our clinics across the country. So whether the clinic is in Seattle and a patient needs treatment, or in Atlanta or in St. Paul, the treatment team can apply here at the main headquarters. And if we have the funds, we will help. And of course, we have financial criteria in place. If a family or a person needs to qualify for financial assistance, but they can be treated at any location and for whatever program.
Great, thank you so much. Okay, well, that is all the time we have for today. Mackenzie and Matthias, thank you so much for joining us. I just really enjoyed our conversation, and I'm sure everyone watching today did as well. Mackenzie, special thank you to you for joining us and sharing your story. I know that you're probably inspiring many people that will view this. For those of you that are viewing, if we didn't get to your question, or you think of another additional question about this topic later, please feel to direct message us through our Facebook page. We also just wanted to mention, if you didn't see the announcement on our Facebook page previously, starting tomorrow, December 4th, and running through December 5th, you do have an opportunity to support the Rogers Behavioral Health Foundation when you shop at Kendra Scott online and use the code GIVEBACK-017H when you check out, and that will give 20% of your purchase back donated to the foundation. Again, that code, yeah, absolutely. Code is GIVEBACK, one word, -017H, and we can post that as well in the comments. And I just want to remind you, for any more information on mental health and addiction treatment at Rogers or other mental health resources, please visit rogersbh.org. We have videos, blogs, fact sheets, and all the information about our treatment programs. Those resources are at rogersbh.org/resources. And then again, our main website is rogersbh.org. So again, thank you so much, Mackenzie and Matthias, and for everyone who joined us here today. Stay well.
You're welcome, Katie. Thank you.
Thank you.